In spite of the unprecedented challenges and pressure on the healthcare sector over the last 2.5 years, we wanted to get someone on to examine the positive change and acceleration of technology innovation that has come from this extraordinary period. I spoke to lifelong technologist and CTO of healthcare and life sciences at Dell, Arshad Farhad. Arshad's doing a PhD. His thesis is on AI and wearables for patient care. And so we talked about this at length, and IoT data analytics combination, which potentially could yield so much positive outcomes in the future. We spoke as well about predictive analytics in terms of diagnosing ailments before they even happen. We also talked about smart hospitals, Internet of Things, and also how the UK healthcare sector stacks up on the global stage in terms of technology utilization and maturity. I think you will love this conversation. Arshad is fascinating and is really passionate about this stuff, and it really comes through in his voice. Hope you enjoy it as much as I did. It's Arshad Farhad. So Arshad, it's great to have you on the Tech Leaders podcast. How are you?
Hey, Gareth. Thank you. And great to be here.
Can you just give us a bit of a summary of your background and just introduce yourself a little bit to the listeners?
Currently, I'm working for Dell Technologies, and I look after the healthcare business in the Europe, Middle East, and Africa. I'm working there as a Chief Technology Officer for healthcare, and also I lead a healthcare vertical practice in the same region, which is Europe, Middle East, and Africa. Prior to joining Dell, I worked in the National Health Services, which is NHS. I've worked with NHS for nearly 13 years at various leadership roles, such as CTO, CIOs, and at different various organizations as well.
Good stuff. So can you tell us a little bit about your PhD and what research paper you produced and what you learned from that experience?
Look, I'm very passionate about healthcare, right? Because it's one of the professions, I think, where you can see the impact on individuals' life when you do some projects. For example, if you're doing some, radiology solution, you can see the improvement. And at the end of the day, any of these improvement will result in savings life or improving patient care, right? So that's what I'm passionate about. So, and obviously that's what I've been working in my professional career. And my PhD research is based upon the same, obviously, healthcare, which is how to use data sciences and artificial intelligence on IoT data, which is coming from medical devices. So for the listeners, again, in IoT, which is Internet of Things, but when you apply the concept on medical devices, such as your Fitbit, could be IoT device, or number of thousands of medical sensors, then we call them as IoMT, which is Internet of Medical Things, right? So more specific to the medical devices. So my research or my PhD is undergoing at the moment, and is based upon how to use data sciences, basically how to use data which is coming from these medical sensors devices, IoT devices, to improve patients' care. So again, it's a journey. Obviously, as you know, I'm full-time working. So I've nearly done half of it, but obviously it's still about three years left to go. So it's great. And obviously at the same time, the good thing about this thing about, especially because it's very niche area at the moment, right? There are a lot of challenges. There are a lot of huge potential, but at the same time, there are a lot of challenges as well, right? So working through the academia, such as how we're going to address those challenges, and then hopefully eventually, once they have been sort of in some productive market, then we're going to bring them into market as well. So it's a mix of both, and I'm really excited what's going to come out at the end of this.
So Arshad, I wanted to ask you about IoT and data analytics and how that is going to affect primary healthcare over the next couple of years. You know, what sort of advancements and innovations excite you in this space right now?
Great question, Gareth. And I think before I answer the IoT part, I would probably take a step back and probably spend a minute or two in where this healthcare is going in the next 5 to 10 years, depending on countries and region, because different regions and countries have different level of maturity in adoption of technology. So where we live at the moment, or the world we live in, is more of reactive world in terms of healthcare, right? Mm-hmm. We go and see our doctors or GPs or hospital or A&E when we have some symptoms, right? For example, if we have some pain, if we have something, then we go in and see doctors, which is more on the reactive basis. But the future of healthcare is relies on more of predictive medicine, which is basically, as it sounds to you or sounds to all the listeners, predictive, right? So before something happens, before maybe a pain start, before maybe something start to happen in your body, the technology or the data which we'll be collecting from the human body, and IoT is one part of that jigsaw puzzle, right? Because when we start collecting the data, and that would be we're going to call the data-driven healthcare, right? So your healthcare is more driven by the data that we are collecting from your ecosystem of your body, right? Because obviously your body is comprised of thousands of different body parts and organs and all those sort of things, right? So in the
Sure.
predictive health, the one of the most important thing is obviously, first of all, we got to have some sort of you may have heard the word the genome sequencing. So these days you
Sure.
go online, you try to look for your DNA profile. So that's just again one part of predictive health. And let's take an example of paracetamol. Right, the paracetamol that you take or I take is made from a generic formula, and that generic formula normally, and this is published in the journal, so it's a well researched data, is around 40 to 45% effective for a normal human being, right? And obviously it varies, but not more than that. So obviously, when we talk about the predictive medicine or precision diagnostic, this is about the medicine is going to be built or is going to be formulated based on your body, how your body is going to react to that. And in that word, which is predictive medicine, the medicine is going to be effective for a normal being for nearly 90%. So now you can think about the difference this is going to make. So all these things obviously are going to come together. So again, this is not just
Sure.
DNA sequencing. This is not just about obviously DNA profiling and getting into precision medicine, but all
Wow.
these
Okay.
things we are working towards more of predictive medicine, right? So hopefully that data-driven healthcare system would be able to predict things before things happen, and IoT is going to
Wow.
play a
Okay.
vital role
So,
in that.
so I suppose what you're saying that the advancement, I suppose, will become more bespoke treatment based on your DNA, so you can preempt and you can essentially predict what people are going to be susceptible to.
Absolutely, spot on. Exactly what you have just
Sure.
described in two sentences. This is where we're going. And it's two things, a mix of two things. Obviously, predicting what your body can come across in your span of life. And secondly, more of the bespoke medicine to treat that symptoms as well. So again, as you can see, the future is great, but I think we all have to work together to get to where we are hoping we're going to get there in the next 5 to 10 years.
Sorry to do this to you and give you a bit of a moral dilemma question, Arshad, but how far do you think we should go with this stuff? Are you in the camp of science? Do you think that we should just try to unearth and predict and influence as much as possible? Or should we sort of treat this with respect and caution and set some parameters in terms of how far we can go with things? Where do you stand on that?
Yeah, sure. The DNA sequencing and profiling, obviously, it gives you an idea about what
Yeah.
your body composition is, right? In terms of where we're getting at, obviously, look, there's a fine line, okay, and obviously where we are doing research in this area about predictive and modeling things, there's a
Yeah.
second line which is of the ethical side as well. So absolutely, those things, those challenges are going line by line, side by side. So while we are progressing on technology, at the same time we have to treat each other and we have to treat patients, most importantly, with respect and dignity as well. I would say, obviously, I'm a man of science. I would say, I think there's a fine line and there's a clear line as well where we are. And one thing I'll make it absolutely clear here. Look, whatever technology is here and possibly whatever technology is going to do, it is not going to replace a human, or it is not going to replace your
Yeah.
clinicians or doctors who are treating you, right? These technology or these areas are there to assist them to make their decision
Yeah,
more
sure.
informed and more accurate. This question I come across very often, Gareth, and you're absolutely right, right? Like people think, do you think that my clinician or my surgeon is going to be replaced by a robot? The answer is no. If you think how robotic surgery is performed, there is a doctor or surgeon who is performing the robotic surgery. We are getting the good bits from the technology, right? To make sure that obviously the control is on the right side, and also patient treatment or the patient care has been delivered to the utmost standard.
Yeah, I mean, having a robot operating on you would be quite scary, wouldn't it? I mean,
But at the same time, Gareth, like, yeah, you're right, it's scary. But at the same time, think about the convergence, right? So, for example, if I have to undergo through, for example, if I have to go through some very a unique procedure or surgery, right? Maybe that specialty doesn't exist in the
yeah.
UK or wherever they live. So, with the help of robotic surgeon, maybe a surgeon sitting in Australia will be able to perform that
Oh,
surgery
absolutely.
on
Yeah.
me. Wouldn't that be great? At the end of the day, it's performed by surgeon. It's just a mechanical robot who is sort of assisting the surgeon who's sitting in the Australia or some other continent. And it has been tested,
Sure.
right? It's not something future I'm talking about. It has already been done. And that's something obviously is going to be adopting more and more.
Absolutely. I know you studied AI for learning purposes, I think was a big part of your thesis. Okay. So I wanted to ask you about, and I know you studied wearables as well in that. I'm a big fan of wearables. I've been wearing a Fitbit for some time. How accurate do you think these commercial data collection wearables, how sort of accurate are they in your opinion?
I think the challenge we are facing at the moment on the IoT concept is exactly what you asked, how accurate these devices can be. This is more of the area where the science and the technology is still undergoing through some research, right? So, for example, you mentioned about Fitbit devices, right? So, Fitbit devices, there are a number of variables in here, right? So, a single Fitbit device is accurate on your body, but at the same time, if you hand the same Fitbit device to a person of maybe a different ethnic origin, the Fitbit device may start giving some different results. So there's a challenge of data quality at the moment and the accuracy.
Mm,
And I think there's still to be addressed. And hence, for this reason, clinically, these devices have not been approved
right.
because researchers, clinicians are quite wary about, right, okay, I'm getting millions of stats at the moment, right? But how reliable are these? Because you may have seen even different temperature sensors. They give different reading on different, again, ethnic origin is just one of the example, right? So there more research to be done in this area, and my area of research, which I'm currently going through in my PhD, is again on the same topic as well, like how we going to improve the data quality collecting and coming from these IoT devices. And some of the IoT devices are good, which have been acquired, which has been given a medical certificate. More common or more generic devices, I mentioned Fitbits and your iPhone and those sort of things. I think the data is still a question mark at the moment.
Mm.
How reliable are they?
Let me run this past you then, Arshad, because I heard a story, and this was a couple of years ago now, that there was a company developing a product which was basically it was like a wearable with a tube that went into the skin and basically did real time blood analysis for people like, with diabetes or with hormonal issues and stuff like that. Have you heard of anything like that in terms of like, sort of the under the bonnet wearable where it's actually, doing actual blood analysis?
Yeah, there are a lot of devices which are currently being trialed at the moment,
Yeah.
right? You're right. You may have heard, I think we all have heard number of IoT devices like cam pills you have seen. You take a pill which has camera in it and it does all
Oh,
your
yeah.
video of body inside and looking at the lesion when needs to be operated or those sort of things. So these are obviously being in production. Some organizations, especially in the US, they are using it. Another area which, if again for the audience, there is a TED talk which based on from Stanford and Mass Gen, which is a Massachusetts General Hospital. They are trialing at the moment wireless or sensorless IoT device which will be collecting data from your body without any physical interaction. Right. So there is a device basically who would be sitting in your home somewhere, and it will be collecting data from the body without having to connect anything, right? So again, these are things of futuristic things. They are currently being under trial at the moment.
Sure.
The example you mentioned, Gareth, yes, certainly I have seen it, and there are more advances coming on at the moment, but none of them at the moment, so far, as per my knowledge, has been validated or certified to be used in a medical practice at the moment, which probably will take a couple of years. And some of them obviously probably will never be validated because of concerns regarding data quality and ethics, those sort of things.
There's some incredible things going on. And so this brings me on to my next question, actually, and something I was keen to ask you about. I know you've worked in the UK for the majority of your healthcare technology career, but I understand you've had a global remit and you've been involved. You're obviously in charge of the Europe, Middle East, and Africa. Where does the NHS, the UK, stand in terms of tech innovation, utilizing technology for advancements in patient care, things like that?
The technology adoption in healthcare hasn't been at the pace that we have seen in some other regional countries. Okay, and there are some reasons, some good reasons, and personally, I would say is more of blockers. But I think if you want me to rate between 1 and 10, where does UK stands at the moment? I would rate probably between 6 and 7.
Mhm. Is there anyone in the sort of 9-10 who's leading the world right now?
So yes, Middle East region, the adoption of health tech there has been quite rapid over there, right? So again, give you a simple example of that. The DNA sequencing is mandatory for a newborn baby who leaves the hospital in Saudi Arabia.
Is it?
Yes.
Okay.
So when a baby born, before he or she leaves the hospital, his or her DNA sequence has been done in the first 10 days. Okay, so they are at that level. And obviously, if you take out the example of UK, like in the UK, the 100 million genomic sequencing project, which was a sort of trial project, was done, I think, 5 years ago. And still now the government or the healthcare organization evaluating how we're going to roll it out massively. And the conversation over there, Gareth, you'll be surprised to hear, like, obviously, the sequencing and profile takes time, right? Because it's a long process. And the first time when it was done in 12 years and more than $1 billion was spent. I'm talking about going back in late 90s, right? But obviously, technology has advanced. So these days in Saudi or those hospitals which I've mentioned, the DNA profiling or sequencing takes nearly a week, right? And when I go and speak to them, they ask me how are we going to expedite that. So rather than taking weeks, it should take days. So that's the conversation we're having in those countries. And obviously here in the UK, and hence the reason I said 6, right? Because we are still trying to figure out how we're going to roll it out on the general population. Forget about the speed, how we're going to roll it out, right? So we are behind. The other area is in some countries, again, not all of them, some countries, rules and regulation are slightly relaxed, right? I think that's one thing which probably not restricting, and maybe some good reasons as well. Don't take me negative on that. Maybe some good reasons as well. Obviously, UK being risk averse, so we think, or in healthcare, we think quite a lot before we adapt or we uh, adhere something, right? So, and hence maybe that reason is slightly taking long, right? So again, giving an example of AI, like AI in healthcare. In the UK, we have been talking from my age when I was working in the NHS. For over a decade, we have been talking about it. But the adoption hasn't been great because of ethical concerns, because of security concerns, all those sort of things. And there are another 10 factors as well.
Yeah.
But hospitals have used AI to detect COVID from a CT scan or radiology scans, right? AI has helped them detecting, and obviously that's practice is increasing more and more. So I think one thing we will have to be very clear about: AI or the use of technology is not there to replace clinician; it's just there to help them. Once we have this mindset, I think things will get easier, and the adoption in technology probably will get better.
So, are there any other use cases in terms of AI in the healthcare sector that maybe people wouldn't be aware of, that are not obvious, that you think will be quite impactful?
In the last 12 months, healthcare vertical have sort of collected 3 accolades. Okay.
Yeah.
So in the healthcare vertical, we have seen the largest data growth amongst any other vertical in the globe.
Sure.
And there's a global data, right? So it's not finance, it's not oil and gas, it's a healthcare. We have seen the biggest explosion of data. The second one in the healthcare vertical, the adoption healthcare vertical has the highest number of AI adoption in the last 12 months compared to any other vertical. And this is not UK data, by the way. This is a global data, okay? And it was done by IDG.
Yeah.
And the third one, which is probably not something to be proud of, is healthcare vertical has seen the highest number of cyber attacks in the last 12 months as well.
That is surprising. Over banks.
Yes.
And,
Not banks.
anything to do with money you think
Yeah.
would be getting more cyber attacks, wouldn't you? Or defense or something, not healthcare.
Well, data is the new money, right? Data is the new oil. So where we have created the most amount of data, so obviously the attackers are shifting their efforts more into stealing healthcare data because of sensitivity of the data that we deal with, right? So yeah, so these are equivalent. So going back to your question about AI, so there are quite a lot of use cases. So AI, the utilization of AI in digital pathology, again to look at your cancerous tissues. Again, a lot of companies are spending a lot of time in digital pathology, not only digital pathology, but also utilizing AI and machine learning to help clinicians make their decision more informed.
Sure.
We are moving into like how hospitals are in the future. They will be aspiring to become more of smart hospitals, right? So in a smart hospital scenario, you will have number of areas where you'll be relying on AI. So, for example, AI would be there to detect, first of all, how the patient is performing, how long the patient stay is going to be in the hospital, the outcome of surgical procedure. Again, AI would be able to assist that. Even in some cases, and that's already existed, AI can also detect if a patient is obviously, this is particularly in hospitals where they are sort of a single accommodation where patients have their own room, right? So it is very difficult to keep an eye on them 24/7, especially for the older patient or a frail patient. So they may fall, those sort of things, right? So AI modules, AI have been developed, have been used to detect a fall for a patient as well. So huge amount of use cases what we have seen, and it's ever developing.
Yeah, of course. I think it probably is in the sort of most technically advanced, like maybe not in the UK, but globally. I think the healthcare sector is probably pushing tech innovation as much as anyone, isn't it? I just wanted to ask you about what's going on at Dell right now. What are you guys focusing on, and what are you most excited about in the health tech sector right now?
Look, I'll give you Del view on about what
Sure.
areas we are focusing on in the next 12 months. Okay, just taking a step back. If you look at what current healthcare organization, what challenges do healthcare organization are facing? So obviously we are still sort of coming out of the pandemic, but it's still obviously after effect of pandemic is still there. So think about the UK. Let's take an example of the UK. There's a huge waiting list there, right? So those patients needs to be treated, those surgical procedures needs to happen, all those sort of things, right? So their views or their inclinations towards how healthcare IT going to help addressing those challenges. There's another challenge which is more of the global and the UK as well, right? Which is probably a good thing and bad thing as well. Good thing,
Yeah.
people are living longer. Okay, the average age of population, we are living longer, but at the same time, when we're living long, our body obviously with the passage of time, with the age, obviously we develop more conditions, right? Pain, you can think of 10 other symptoms, right? So what I'm trying to call here is obviously people are having more and more chronic condition, right? Chronic condition, any condition which lasts more than 12 months, they are called chronic condition. So when we live longer, people have more chronic condition. It means they have to rely on hospital more and more. So what we are saying here is, now you can think of what's going to happen. It's going to have more pressure
Yeah.
on the healthcare system. So how are we gonna address that, right? And the third thing, which is very good as well, again, I would say that's positive came out of pandemic is the patient expectations have changed. Go back 2 years, probably you would have never imagined or thought about doing a remote consultation with a doctor, right? Or having a treatment done at your home, right? So this is sort of never been thought of, but obviously in the last 12 months or so, we have started it, we have seen the value of it, and I think this is going to be continued as well. Not for each and every symptoms of not for each and every patient, but a good percentage of the
Mm,
symptoms and treatment can be done remotely. At least some of the consultations can happen, right? And this goes in favor of the
sure.
hospital and for the patient as well. Hospitals or healthcare providers now have to align themselves in the technology roadmap to meet those expectations as well. So now these are 3 or 4 like global challenges what we have seen, and I think they're no different in the UK as well. UK are the same. So based on these trends, we are putting our efforts at Dell in 5 big areas. First of all, for healthcare, we have dedicated practice. We have a lot of professionals and subject matter experts like myself, like who have worked in the healthcare industry, have come out of the healthcare industry and helping our patients and indirectly patients and obviously other organizations to enable the digital transformation in their organizations. So our bet for the next 12 months is, first of all, we are going to focus hugely on edge-based healthcare. So there's a huge adoption of edge computing in other verticals as well. But at the same time, in the healthcare, we call as treatment at the edge. Sure. Okay, so when it means anything which you're treating outside the hospital premises, that's your edge-based treatment, right? And it means it brings a lot of challenges. Think about it. So if I'm going to hospital, it means I have the doctors and clinicians have fixed computers, fixed number of devices, and IT have to deal with them. But when you start rolling out your services in the community, in the field, or in the homes, then now you have to come across millions of devices and petabytes and exabytes of data to deal with, right? So obviously that's a huge challenges that a healthcare organization have to come across, right? So that's where we are focusing on, like healthcare facility and providing the healthcare outside the hospital, so edge healthcare.
Yeah, absolutely.
The second area that we are focusing hugely on, obviously, which is probably no surprise to anyone, is the utilization of AI in healthcare. So we are working with a lot of startups who have specialized in healthcare, partnering with a lot of our partner organizations who have expertise in AI and machine learning in the healthcare-based setup. And we are working with them to build a joint solution and propositions which should be useful and which should be meaningful for our healthcare organizations. The third area is of the data management, right? So what I have said so far, the edge, the AI, they all rely on the data. And the last 12 months from the experience, the data growth or the tsunami of data, we call it in the healthcare, is going to grow and grow, right? So the data management practice, which used to happen in the past, have changed significantly. Let me give you an example. So when you have your PACS or your X-ray done digitally, okay, most of the time they are used in the first 6 weeks, okay. Talking about the UK healthcare setup, by the way, okay, but they still have to be kept for governance and security reason, for depending on type of patient, for at least 6, and it could be 30 years, and sometimes lifelong, right? And these images, X-ray or PACS images, are quite big in size as well. Okay, so most of the time, healthcare organization or NHS hospital, they keep those images or X-ray digitally for indefinite period of time. Right? So what they used to do is after 6 weeks, they used to archive them, like put them into very like slow storage or some sort of tape devices where they're just there for the governance reason, right? They probably never get used again. But now we're talking about the adoption of AI. So when you are starting doing AI and you're training your data set and you're matching your incoming data with the previous data sets and inferencing them, then these images, which I said can be archived, which you used to say in the past that can be archived, can no longer be archived because they can be used anytime now, right? So the whole data management has changed because how the AI and machine learning is going to be used and applied in the healthcare sector. So that data management piece is becoming more vital and vital. So we are focusing as a Dell, as a technology provider, we are focusing our customers to get them what data management for healthcare should look like. We are assisting them as well, right? So that's the third area we are focusing on, because we know, a healthcare organization know, that in the coming world, in the data-driven healthcare, the reliance on the data and the reliance on and the quality of the data, which is again very important, is going to grow more and more. So how to make sure the data they are accessing, they're using, is accurate, is up to date, and this is something what they need. The fourth area where we are focusing on is, again, probably no surprise, I've probably said it already, is the data security, which includes cyber recovery, cyber security as well, right? So we are creating more and more data, right? So obviously, at the last 3 years or so, if you ask a CIO of a hospital what keeps you awake at night, he would say cyber attack or cyber something, some sort of attack in my data in my hospital, right? And now think about the challenge, how we have further complicated the challenge, right? So previously, while these hospitals only have to deal with the devices and the data which were coming from their hospitals, or maybe some one or two remote hospitals, now they have to deal with the data which are coming from homes, from your IoT devices, from number of clinical practices which are outside hospital. So we have sort of multiply, or we have sort of increased the devices to be managed and secure by 10 times than what it used to be. So it has increased exponentially, and 10 times in some cases that has impact on the security has increased. So that's one area we are focusing on a lot, and we have worked with quite a lot of organizations in the UK, obviously outside UK,
Yeah.
as well, to build their data security continuum, how they should deal with the data security, where the data is being created from right from the edge, which is outside hospital, bringing into the hospital, and finally the cloud. And the fifth area for the focus for healthcare organization is adoption of cloud technology as well. So again, in the healthcare in the UK especially, the adoption of cloud hasn't been great uh, until last 12 months or so, because now healthcare organizations have seen a real value in what these cloud providers can provide, the ability to obviously to operate their IT or ICT system in much more agile form, in much more simplified form, and also at the same time making use of all the latest and greatest AI, machine learning, deep learning, and other these tools which are only born in cloud. They're not available in their own hospital. So they are looking more and more the adoption of these cloud providers. So we provide a very simple messaging which is called Dell technology, multi-cloud for healthcare, which basically extend your data centers from your hospital into the cloud and provide you the same manageability between on-prem and off-prem system. So these are the 5 areas, Gareth, we're going to focus on as a Dell technology in the next 12 months or so.
Wow, you've got a lot to do then, eh? You've got a lot on your plate. There's a lot of stuff going on there, but it all makes total sense. And that's, obviously everything you talked about is quite an apparent trend, across the healthcare sector, from a technology perspective. As much as I would love to unpack that, I wanted to bring the conversation back to you. And you went into the role of CTO 2018. You came from a very sort of, IT infrastructure background. I mean, a lot of CTOs come from a software background or even more of a sort of business commercial facing background, but you came from a very core IT background, which is very refreshing. So I wanted to ask you about that transition from being a senior systems engineer into a leadership role like a CTO, and what was the main challenges that you had to overcome?
Yes, you're right. I started my role as CTO nearly 2018, which is nearly 4 years now. Believe it or not,
Yeah.
my God, time flies, right? One good thing about Dell technology is when they spot some potential, then they put into a track where they want this individual or individuals to build their career in the next 12 to 24 months, right? So I was put into a leadership track after spending for the first 2.5, 3 years into Dell. And the purpose of that solely was to obviously create more of a thought leadership sort of role. Okay, so that was a track I was put in, thought leadership role. Right? And in this role, obviously, there are few areas that they want me to be focused on, and they'll help me developing my skills as well. First of all, obviously, public facing skills, because as with the role, I spend most of the time in front of the customers, in front of events, in speaking, talking, writing, those sort of things, right? The second area, obviously, which organization or that has comes with the CTO role, is working with your ecosystems of partner, right? So Dell is in healthcare specifically, yeah. Like one thing I would say, Dell is an infrastructure solution provider, right? And this is what our core business is. But at the same time, what we do well is we work collaboratively and very closely with the partner system ecosystem that we have around us, which are in thousands, right? So think about all those healthcare providers, GE, Aqua, Epic, Cerner, name any healthcare provider. We work very closely with them to make sure that we are working hand in hand with them, right? So that's another area that I spend a lot of time, and organization help me developing my skills towards it
Mm.
as well. And the third area is more towards the leading or more of the leadership role. Again, like leadership role is something I have done in the past when I was in the NHS working in the hospital, and that's something I liked it. But the first 3 years at Dell, I was more of individual contributor, I see. But I think organization, as I said again, they look at the potential that I had, and they put into the right track training and the assistance I needed to get into CTO role. And the transition, I would say, uh, it was a learning curve. The first 12 months or so were challenging. We're coming across a lot of new things, which I didn't expect as a part of this role. But now, as a part of 3 years being in the role, I think they all make sense, first of all. And I think I've sort of
Mm.
gelled well into this role. And I'm looking forward to whatever comes next after this.
Okay, brilliant. So, what characteristics and attributes have the best leaders that you've been around and or you've reported into? What characteristics and attributes have they had?
I will give you an answer very, very short and sweet. Only two things I would say. First of all, on a personal basis, an individual is more about being attitude to make a positive difference to the life of others, or in other words, passion about healthcare. And this is what I love most about my job, right? And being in the healthcare, I think the healthcare vertical, you got to have this passion for helping and about making a difference. The second thing about leadership, I think what I've seen, which has helped me, is the freedom to do things in your own, or to
Mm.
take initiatives and to support my team and other individuals. So if these things you have, I think you could go a long way.
I think it's being positive and being, rolling your sleeves up in the face of adversity. That kind of has a massively positive effect on the people around you, doesn't it? And I think sometimes, especially when there's a pandemic going on or you've got challenges with certain clients, sometimes it's quite difficult to do that, isn't it?
Yeah, no, absolutely. Like I think during the pandemic, during the first 6 months or so, I know people have majority of the people are sitting home. They probably have quiet days from work. But being in the healthcare, that was the busiest time for all of us who are engaged in healthcare. Obviously, I'm not counting clinicians because obviously they had a super busy life that time. But even in being in the IT sector, the way the people were looking at it as obviously technology to help them, we were like right busy, more than 14, 15 hours a day we were working during the first 6 months or so. So yeah, these attitudes to help people, compassionate about obviously people, these things really, really help, especially in the healthcare IT
Yeah,
sector.
for sure. I completely agree. So the last question I wanted to ask you then, so what person, book, or story have you been most inspired by then?
Oh, that's an easy one for me. Person, I would say, and that's my dad. Is one key attribute from which I have also adopted as well is the amount of work he had put in while doing what he was doing. I think that's extraordinary, and I think I really look up to him. And that one quality, if I could have it in my life, I think I would be super successful. So my ideal role character, where I am, and I think I will look up to him, is my dad, and I think the way he has built his career and what he had done. I think two main attributes is hardworking,
Sure.
and the second thing is obviously is more towards respect for others. I think these two things what I have learned from him, and I think I try to put those characteristics in my life and in my career as well.
That's really amazing, Arshad. I think just out of curiosity, is your dad in a similar line of work to yourself?
No, yeah, he passed away last year. No, he used to run his own business, very small business. He sort of created his business from nowhere. He had to do a migration between countries twice, so he sort of has to come back to zero and start again twice in his career. And the way he did it, I think it was extraordinary.
Well, Arshad, I think that's we've covered so many areas and things today, which I think is lots for the listeners to chew on and contemplate. So thank you so much for your time.
No, Gareth, it was a pleasure to be here, and I do hope there's some good lesson to be learned in the last 15 or 20 months what we have discussed so far.
Absolutely, completely agree. So I just want to take this opportunity to thank you for downloading this episode. We really love doing this show and are absolutely humbled by all of the incredible people who download and listen, plus the incredible guests who take the time to come on and share their secrets and experiences with our listeners. Please can I ask that you take a couple of seconds to subscribe or follow the show. This small action means a lot to us and helps us greatly. Thank you. As you quite possibly have heard me mentioning in the past, we record the mass majority of our episodes at an amazing studio facility here in Cardiff at Tramshed Tech. Tramshed Tech is a collaborative community of entrepreneurs and scaling businesses geared towards supporting growth in tech, digital and creative industries across an ever-increasing collection of locations and partner locations, UK-wide and internationally. It really is the perfect place for your business to start up, scale up, accelerate or innovate. Head over to tramshedtech.co.uk or just search Tramshed Tech on your favourite social media platform.